Hello, everybody. Thank you for the opportunity to present in this conference. I do apologize that I couldn't attend the live presentation, so I'm sending in a video presentation. My name is Nonyeto Chiaganya, and I'm a healthcare provider. And I've worked in various healthcare settings for just over 30 years. After I obtained a master's degree as a family nurse practitioner, I co-owned a private practice in New Jersey for about 7 years, and I've worked in the retail clinic setting for over 17 years. Till just about a year ago, when I joined a home care setting in my current role as a family nurse practitioner in the state of Virginia. But before becoming a family nurse practitioner, I was a registered nurse for 10 years. And I worked in the Beth Israel Hospital and also in subacute and long-term care facilities in New York City and New Jersey. And in these many roles in the healthcare system, I must mention that I feel quite honored to have engaged with patients of diverse groups and various personality traits in the different states. And personally, I've always been very intrigued by human behaviors, and I've always been keen about reviewing research studies on human behaviors that have been done by various psychologists, scholars, and psychiatrists around the world. And I've published various books with contents that are based on these research reviews and the extensive engagements with patients that I've had for many years. And many of my books highlight the influence of the use of the soft skill of communication as a tool for trust development in healthcare settings. As a member of the Virginia Council of Nurse Practitioner Body, I participate in council activities, and I also love to write articles for various online journals and health publications. And today I'm really excited to present on this important topic: communication in healthcare, why digital innovation is not enough. After completing this activity, participants should be able to identify the various human personality traits and the influence of these traits in building relationships between the healthcare provider and the patient. And also, as importantly, participants will aim to apply this knowledge to improve their communication skills during their interactions with patients, especially those patients with attitudes that manifest due to their underlying anxieties about the clinical experience. Yes, that was me in 2013 after a serious medical crisis that was quite debilitating. Thankfully, I'm much recovered today, but I must say that this medical ordeal created a lot of anxiety for me. As a patient, I remember experiencing so much anxiety and physical pain. And being a healthcare practitioner at the same time as well, it was truly a humbling experience because it showed me firsthand that many patients, if not all patients, experience various levels of anxieties due to the feeling of not knowing the outcome of any given clinical situation. And looking back now and remembering all the positive engagement that I had with my healthcare providers, the nurses and the doctors that cared for me, it definitely helped to solidify my understanding that communication is a central focus for the healing process. Because when implemented correctly, it helps to create a tranquil environment where trust is developed and healing thrives. And at this moment in time, amongst many others, it became part of the inspiration for my journey to help improve communication in healthcare settings, to help improve the trust between healthcare providers and patients. Communication, as we all know, this involves the use of electronic devices and gadgets as well, such as the smartphones, computers, laptops, and wearing devices such as smartwatches, amongst many others. And we know that this has steadily made its way into the healthcare management system. In the past 10 to 15 years, there's been a gradual increase in the implementation of virtual care delivery in various healthcare sectors. And as we know, digital innovation for care management was actually more embraced in the past 5 years due to the global pandemic of COVID-19. And in fact, data reviewed from the Pew Research Center showed that at the height of the COVID-19 pandemic in 2020, there was a major reliance on the use of digital devices for such activities as staying connected with friends and families, searching for outbreak-related information, engaging in telehealth consultations with providers, and also performing daily work responsibilities remotely, amongst many other uses. And quite frankly, the telehealth process not only offered a much needed relief from the stress of the demands of the pandemic care, but it was also seen as a safer way to implement care delivery while minimizing the risk of infection from respiratory mode of transmissions. Okay, granted, it's fair to say that the virtual care delivery system is a great innovation. But just like every invention since the dawn of modern civilization, its implementation in the healthcare delivery process does have some pitfalls. It lacks a very important aspect of care delivery, which can only be achieved with a broader interactive approach. Let's remember that such broader interactive approach explores the application of such disciplines as psychology, closer observation of patients' behavioral traits, cognitive biases, and the psychology of language. Because it's important to address these necessary factors to ensure that a more successful attempt by the healthcare provider is made in assisting patients to achieve a healthy physical and emotional well-being. So we find that when there is a growing reliance on the exclusive use of digital devices as the primary mode for care delivery practice, this could actually hinder the provider from achieving the full spectrum of human interactive process, which is paramount for optimal care delivery. Okay, let's take a moment now to consider what this image could represent. We can't highlight the impact of human behavior for trust development in healthcare settings without a glimpse into the healthcare atmosphere. The healthcare environment is an emotionally charged one, capable of inducing various levels of anxieties and fears. And we are living in an emerging world of technological advancements where healthcare providers are expected to adequately assess patients' histories, arrive at a diagnosis, and provide treatment plans in fast-paced environments. Such expectations is typically true in rapid care delivery settings, such as urgent care, walk-in medical clinics, retail clinics, and emergency room settings. And at this faster pace, and with the progression of time, it becomes more difficult to efficiently engage with apprehensive and anxious patients in these emotionally charged health management settings. A 2009 quote that I came across during one of my many research reviews from Bashashaw and Shannon best summarizes this point, and it says, "We are living in the age of high information and communication technology with long-standing problems of improving human health in healthcare systems." So at this point, many, if not all of us, are asking ourselves, so what is the solution? That is, what can be done to help promote a more tranquil environment, which improves the chances of effective engagement and trust development between the healthcare providers and patients? And that's a question with no single simple response. Because for me personally, it's fair to say that all my life, since I was a little girl, I've loved to and have always been on a constant quest to objectively understand human behaviors. And in my quest to fulfill this understanding, I've reviewed various studies which highlight several factors that contribute to human behavioral patterns, and more specifically, the presumed decline of trust in healthcare settings. On this slide, we find a few of the many views by philosophers, psychologists, psychiatrists that I've explored in the past. A notable quote from Desh Shuba, a philosophy scholar and the author of Philosophy of Fearism, always resonates with me, and he quotes, that knowledge generates fears, and knowledge is useless if we don't understand the fears surrounding the knowledge. The fearology concept and review of content from fellow fearologists such as Sinakachi Akumakalo and Dr. Michael Fisher also shed some light on the influence of real and perceived fears on human behaviors. So we find that we must continue to focus on the emerging fears that technological advancements could pose as we come up with means for curbing and addressing these anticipated fears. Review of research studies done by Dr. Steven Serziak was also an interesting one. And in his 2018 TEDx talk, Dr. Serziak, who served as the chief of medicine at the Cooper University Healthcare in Camden, New Jersey, highlighted the differences between empathy and compassion and how these differences influence the concept of trust development in the healthcare systems. A bulk of his work is found in his many books, including one of my favorites, known as Compassionomics. And the research study reviews continues. I actually did mention that this is a favorite hobby of mine to review research studies that have been done for years. And I really do enjoy spending time to, really look into various views that have been out there with the changing times and changing demographics and changing life experiences. We find that behaviors can always be interpreted based on past research studies that have focused on these behavioral traits. So this more recent global study that I reviewed was actually done at the height of the COVID-19 pandemic by various psychologists around the world, such as Godzi Itza, Kowal Mata, and many others. And this study in particular explored the link between personality traits and the mental health of individuals in various parts of the world, being that the pandemic was a worldwide event. And the findings of this study are published in the digital database PubMed Central, a free archive of life science literature at the U.S. National Institute of Health Library of Medicine. I also included a link to the full study content on this slide. And upon review of this study, I finally ran into content that helped to explore the psychological trait theory and how it serves as a measure for assessing human trait qualities based on our natural inclinations and dispositions. One notable finding of this particular study is that it highlighted a model which describes personality as a system of 5 traits of neuroticism, extroversion, openness to experience, agreeableness, and conscientiousness. And what's truly interesting is that the researchers showed that this 5-dimensional structure model could be replicated across all regions in the world. And this can easily be interpreted to mean that when faced with adversities, such as the loss of health and well-being, as was evident during the global pandemic event, individuals across the world with similar personality traits tend to display similar behavioral patterns, despite their diverse cultures and background. And this is because there is no color associated with the human emotions of fear, anxiety, rage, elation, or apprehension, amongst many other human emotions. Okay, now let's delve into a few of these traits individually and identify the steps that we as healthcare providers can take to effectively engage with individuals who present with such traits for a better chance of establishing a more productive engagement. Take, for instance, the trait of neuroticism. Patients who present with such attributes as anger, impatience, feeling easily overwhelmed, may have underlying personality traits of neuroticism. Take, for example, this is a trait where you may encounter a patient who is less open to engaging in shallow chit-chat conversations. such as how is their day going, or how is the weather, or talking about the traffic patterns before they come in for a consultation process. There always seems to be an underlying irritability, and patient may not be just open to having chit-chat conversations with the healthcare provider. And sometimes patients with these particular traits may display emotions of anger very easily, and sometimes they have no reservations about voicing their own opinions. In such a case, as healthcare providers, it's important that we listen more than we speak, to never ignore the patient's concerns, to pay close attention in order to determine the accuracy of the patient's statements, and then gently engage in a dialogue for clarification of views. It's important to respond with statements like this: please correct me if I'm wrong, but I heard you say, and then you fill in the blank by repeating your own interpretation of what the patient's views are. This pattern of engagement not only shows that the healthcare provider is attentive to the patient's views, it also creates the chance for clarification of viewpoints, and this method helps create a more tranquil atmosphere for a more productive dialogue. And I must mention that this is just a simple factor of the trait of neuroticism. More information that expand on this personality trait can be found in my book, Tips for Effective Communication, a vital tool for trust development in healthcare settings. For the sake of time, I will speak on just one more psychological trait. So let's explore the trait of conscientiousness. We find that individuals with this personality trait tend to be organized, dependable, and show self-discipline. They aim for achievement while performing planned rather than spontaneous behaviors. And over the years, I've found that patients with traits of conscientiousness may tend to be a bit opinionated and sometimes attempt to project such opinions onto the healthcare providers. At times, they may show an unhealthy level of confidence in their medical knowledge and their ability to interpret their symptoms. Say, for instance, a patient who may have families in the medical profession, and they've gathered these various health information from that family member prior to visiting the healthcare provider. And sometimes patients, as we know, tend to go online and Google their symptoms. They use the famous Dr. Google, and then they attempt to sway their clinical views or outcomes of provider consultation process. And in this category could also be patients with chronic illnesses who are used to getting particular treatment plans and would oppose a provider's attempt to explore alternative treatment options because they know their bodies and know what works for them. Usually tends to be their mantra, because they know their body and know what medication and what treatment plans works for them. In these instances, the clinical goal is to gently but firmly explore various treatment options with the patient in a partnership model. And there is no one way of achieving this, but it really helps if the healthcare provider has a strong clinical knowledge base. And as healthcare providers, we should strive to implement the communication technique of decisive mannerism. And more specifics about this mode of communication can be found in my books, Tips for Effective Communication, a vital tool for trust development in healthcare settings. Chapter 14 of my book focuses on the best engagement styles when your patient is also a healthcare provider by profession. So let's take a look at this slide, and we see that on the right side of this image is the healthcare provider, and on the left side is a patient who happens to also be a practitioner as well. And sometimes realization that a patient is also a healthcare practitioner could create an awkward consultation if the engagement is not approached effectively. In this scenario, it's important to acknowledge that the patient is a provider as well, and to avoid treating the patient as a complete novice. It's best to limit private chit-chat conversations, which can become a distraction, and it's better to make it a partnership encounter as you focus on the patient's ailments and knowledge base. This strategy helps to promote confidence and trust in the consultation process. Okay, a quick mention of other personality traits, such as the extraversion trait, where we have such characteristics as patients who are talkative, energetic, sociable, and enthusiastic. And in my book, we'll also find strategic patterns for productive engagement with patients who present with such traits. And we also have the agreeable traits. And patients in this category may struggle to assert their needs and wants, or may tend to prioritize the needs of others above their own needs. In a chapter of my book that I titled The Dependent Patient, I explore these unique characteristics in depth, and I detail out the most effective engagement styles for achieving successful dialogues with patients that present with this trait. And sometimes we find that these traits are similar, to patients, who have been influenced in the past by either their cultures or backgrounds or even personal experiences. And as time goes on, they find that based on these experiences, this becomes the dominant trait that tends to present itself during a consultation process with their healthcare providers. Regardless of the scenario that the healthcare provider may encounter, it's important to note that all patient concerns, no matter how grave or insignificant it may seem, must never be ignored. As healthcare providers, let's learn how to use various styles of communication at the most appropriate moment to help promote a connection with our patients. It is a skill that can be learned. Let's identify when to listen more than we speak, when to temporarily avoid eye contact to give another person a chance to develop their train of thoughts, when to use a gentle pitch to promote a tranquil environment, when to maintain eye contact to command attention, and even when to use humor to loosen perceived tensions in the environment setting. Let's remember that when patients come to us, they are usually in a very vulnerable state of mind with underlying pain, which could be physical, emotional, or psychological. They need solace from us as healthcare providers so that even when they display anger, they need help. When sad, they need consolation. When insulting, they need attention. And when talkative, they need a listener. When impatient, they need a healthcare provider who is patient with them. Patients look forward to engaging with healthcare providers who make the effort to understand their mindset, even when they are unable to articulate their thought processes through communication. It's fair to acknowledge that some of these behavioral traits could be distracting, making it more difficult for healthcare providers to establish a trusting environment. But it's important to emphasize that a compassionate approach is universally appreciated by all patients, despite their dominant presenting behavioral trait. So let's practice with hearts of compassion. Let's learn how to use various styles of communication at the most appropriate moments to help promote connections with our patients. Finally, I'm going to recap with this. Communicating health is an art that can be learned. It is a mindset of who we are versus what we are. In the who we are mindset, our focus is primarily on our knowledge and training, but we must never neglect to also focus on what we are. We are healthcare providers with the responsibility to communicate healing to our patients. Technological advancements will continue to enhance healthcare delivery process, but let's not forget that communication remains the backbone of human connection. Our profession is a delicate one, and we must assume our responsibilities with a sense of honor and sincere dedication. Thank you once again for the opportunity to present in this conference. These are some of my published books available on my website, nonyetochi.com. They can also be found on Amazon and other retail bookstores. And these are some of my social media handles. You can follow me on YouTube or on Facebook or Instagram. My handle on Facebook and Instagram is at the Family Nurse, or you can search for my name on YouTube to follow my official YouTube page. And the rest of the pages are the references that were used to put this presentation together. And this is the final page of the presentation. Thank you so much once again for the opportunity to present on this very important topic.